Hey everyone, and thanks for joining us here at Unprocessed Sugar. I'm Dr. David Sugar, your host, and we're going to do something a little different. I'm calling this the episode before the episode. What I'm going to do from now on is give you about a 3-minute little synopsis. It's basically going back to what the mission of the podcast is. My journey, what was going on with me, what was I going through, what did I learn, what have I done, what's worked, and what didn't. What this will be is in a PDF form. If you'll go to our website, unprocessedsugar.com, you'll be able to get that PDF. All of these things will be in a lot more detail. I'm going to go through them rather rapidly to not belabor it. But again, go to the website, and when you're there, subscribe on the YouTube channel as well. But today we're talking about sleep. Now, I used to think sleep was, okay, I get in bed, I put my head down. Sleep starts from the moment we wake up. Get some sunshine, get some water, get hydrated. And again, more explanations in the PDF. So it really starts at the beginning of the day, not at the end when we put our head down. Throughout the day, get some movement. Simple as going for a walk, do some stretching. If you can get some resistance exercise every now and then, but it doesn't have to be elaborate. Eat. I lost a significant amount of weight in the last couple of years, and I did it basically by starving. Not a good idea. I would not recommend it. When fasting has got some benefits, but when you go long periods of time of fasting, it spikes your cortisol, which is the enemy of sleep. I had a horribly high cortisol level, and I'm working on bringing that down. So eat throughout the day smartly. Watch some of our episodes on nutrition, and you'll learn a lot from there. Take some time during the day to be still. Do some breath work, maybe some meditation. There's something called yoga nidra, which is awesome. It actually rejuvenates you, kind of wakes you up during the day, even though it's a meditative format, but it also helps later on in the evening for things to transition down. Then in the evening, no food within 2 hours of sleep and no screen time within 2 hours of sleep. I used to sit with my iPad in my lap in bed. Wreaks havoc on your sleep. Try to get into a routine. Doesn't have to be too regimented. Some people journal, some people pray, a little stretch, a little yoga. It just tells your body, and particularly your nervous system, hey, it's time to wind down and get ready to go to bed. Now, I'm in bed. I do a few things. I do some more breath work. I do some somatic stretching. I'll explain more of that again in the PDF. I don't want to sound like a broken record. Make sure the room is dark as possible. If there's lights coming in, get dark out shades, get eye coverings, but it's got to be as dark as possible and cold. 66 to 68 degrees is preferred. It will do wonders for you. Now, I also take a lot of supplements to help us sleep. There's a supplement made by the AG1 company. They make the greens. They have AGZ. I'll let you again see what they have on their site, but also on our PDF. It's got almost everything you need supplement-wise, but there are a few other things I tweak to it. But if you don't want that, I'll give you my stack for a minimal amount of supplements you can take that will help your sleep. I'm also going to have a link to Fullscript.com where you can go in and I can get you a discount for anything you order. If you have a recurring subscription, you get an even bigger discount. And lastly, I use some gadgets, some tools. I have something called an 8 Sleep. It's a mat on the bed, cools it down. I stay nice and cold throughout the night. But again, you want that full list of those, check out the PDF, unprocessedsugar.com. The PDF will be there. Subscribe, we'll get your email, we'll send that PDF to you. Actually, you'll be able to download it. And you'll also have the link for the Fullscript, which will give you all the protocols I've got for things like sleep and nutrition. So thank you very much for joining us. I hope you enjoy this next episode on sleep with our guest, Dr. Steve Scheer. I appreciate you joining us on Unprocessed Sugar. Hi, everyone, and welcome to our next episode of Unprocessed Sugar. Today, we're going to talk about sleep. It's part of our Fess Up platform, food, exercise, stress, and sleep. We've done food, exercise, and stress so far, and today we're going to tackle the thoughts on sleep. Today, joining us is my own personal sleep doctor, Dr. Steve Scheer. He's been in practice here in Sarasota for 20 years, I think, right?
That's exactly right.
And he's taken time out of his busy schedule to join us here today for our episode on sleep. So welcome to the show, Dr. Scheer. Again, thanks for taking the time out of your schedule. I appreciate you joining us.
Thank you very much, Dr. Sugar. It's a pleasure to be here.
Well, why don't we just start with some basics. what is sleep and why do we need it? Why does a human being even need to sleep?
Well, thank you very much, Dr. Sugar, for inviting me. I'm very excited to be here to participate in your Fess Up program.
Yep.
Sleep often is a pillar of the best quality of life, includes the best quality of sleep. And so it's important that you include that in your program, and I'm happy to be here to help be a proponent of good quality sleep. Sleep is a recurring, reversible state of reduced consciousness.
Okay.
And it means that every day in a 24-hour cycle, a circadian rhythm, if you will,
Right.
we have periods of higher levels of energy and lower levels of energy, and it is on a cycle. There are some physiologic reasons for that. There's a process called our circadian rhythm
Right.
that's controlled in a certain part of the hypothalamus of the brain. And the circadian rhythm is the regular cycle of when we feel tired, which starts just after dusk, when melatonin, a hormone that is secreted as the retina is able to determine that there's less light,
Okay.
increases the amount of melatonin until it peaks and you feel sleepy. And then it comes down over the course of the night, the melatonin, and as you sleep longer, you have less need to sleep. So the other process is a homeostatic process, which when you are sleeping gets decreased in the intensity of a hormone called adenosine in your brain. When you are awake, that adenosine accumulates. The longer you've been awake, the more adenosine, and the more tired you feel as the day goes on, you've been awake. So it's a regular cycle that we have for being asleep and being awake during the course of a 24-hour period.
Gotcha. So there's obvious benefits to getting good sleep, rejuvenation and feeling better. But I mean, what our brain accumulates waste products, from what I've learned, and we don't get rid of those unless we're sleeping. Is that right?
That's right. So sleep is important in just about every physiologic functioning of our body.
Right.
Cardiovascular, cognitive, immunologic, hormonal, endocrine, and even mood. All those things are affected by having a good quality of sleep. As you mentioned, waste products, we have a certain process of accumulating waste in the brain, and beta amyloid is one of those products. It seems that beta amyloid is one of the most important problems that people who have developed Alzheimer's dementia have an accumulation of, and the brain is so riddled with it that thinking processes, memory, and so forth are declining as people have Alzheimer's. Well, that substance, beta amyloid, accumulates in the brain over the course of a day.
And those are the amyloid plaques. I'm sorry to interrupt. That's the amyloid plaques, right?
Okay. Plaque.
Right.
So that substance is reduced at night with deep sleep.
Okay.
So one of the good things about deep sleep, that if we all get it, we are helping to get rid of the waste products in our brain. But some people who have very fragmented sleep, who have very little or no deep sleep, will end up having this accumulation of beta amyloid that doesn't get reduced.
Okay.
And eventually can be deposited and become a big problem. So, for example, there's a famous study that was just published this past year in the Journal of Clinical Sleep Medicine, where they did sleep studies in several hundred adults, and then 15 years later, an MRI of the brain was taken.
Okay.
And there was a direct correlation with those people in the earlier sleep study who had reduced or absent deep sleep with the amount of beta amyloid plaque that was accumulated 15 years later that could be measured on an MRI.
Okay. And do they see a higher incidence of Alzheimer's in those people?
That's correct.
Wow. Okay.
And in addition, there's another important stage of sleep, REM sleep, which occurs in the course of a night periodically, a little more towards the end of the night than the beginning of the night, whereas deep sleep, the restorative type, is earlier in the night.
Okay.
REM sleep occurs every so often throughout the night, but a little more at the end, and it is when we dream. And REM sleep is also important for consolidating memories that you've learned during the day, that night, Having REM sleep helps you to remember the same thing you learned the next day.
Okay.
Also, REM sleep's important for creativity and for improvement in our mood.
Gotcha.
So people who are denied REM sleep may end up having more depression, as an example.
Okay. Now you mentioned melatonin, and I've learned that one of the best things we can do for our circadian rhythm is get exposed to sunlight early in the day. That sets that axis in motion, and it knows that 14 hours later, it should start making melatonin. And I know people who take melatonin supplements. They think it's a supplement. It's not. It's a hormone, like you said. And I follow Dr. Andrew Huberman a lot, and he is very anti-melatonin. Instead of giving your body more melatonin, do what your body needs to make its own melatonin. So get outside and get sunshine first thing in the morning. Another thing I've also learned from him is the concept of nootropics, things that are good for our cognitive health. Phosphatidylserine and lion's mane, things like that. But he was going down a list of the best nootropic for recovery, sleep. The best nootropic for anti-aging, sleep. And down the list, basically sleep is the best thing you can do for your body's recovery and longevity. So let's say I'm not getting a lot of good sleep. I'm accumulating these plaques. Is it reversible?
So that's a very good question. I don't know if that study has been done
Right.
to show a reversible nature to plaque accumulation, although I know that part of all the Alzheimer's and, for that matter, Parkinson research, a lot of it has to do with, does reducing the amount of plaque actually cause the condition to go away? And is it even possible to reduce the plaque?
Okay.
Because everybody does have plaque,
Right.
that builds up in the brain as we age. Even people who don't have clinical Alzheimer's show a considerable development of plaque as they get older, but it's just not in the wrong places and the wrong amounts,
Right. Okay.
like people who have clinical Alzheimer. But these hormones, melatonin being a principal one, it's becoming more and more controversial. The amount of melatonin that is consumed that people buy in drugstores everywhere has gone up logarithmically, a huge amount in the past 10 years. Even in children, a lot more than used to be the case. Children take melatonin. And it's become controversial for a couple of reasons. For one thing, when you get a pill that says melatonin on the side, 5 milligrams, you really don't know what it has in it. None of the companies that make melatonin are willing to really go up against each other to get this tested, because they know that it's not always the best rigorous standards that are used to put the amount of milligrams on the side of the bottle that actually is in the pill.
Oh, wow. Okay.
So they're very variable in terms of the purity of the melatonin.
Sure.
Secondly, now there's more concerning research that has just come out. I mean, in the past year, it's not exactly been followed up with more rigorous studies, but a concern that you might, if you take melatonin long term, have a risk of developing congestive heart failure.
Oh, really?
Developing it as you take it. Not for short-term use of melatonin,
but the long term.
For people who take it 3, 6, 9, 12 months and longer.
Okay.
And even in my own practice, whereas we used to prescribe fairly casually the standard sleeping pills, we don't anymore. And now we've moved to taking melatonin and recommending that. And now there's this concern that recently has been raised about chronic use of melatonin.
Okay.
So it's really very difficult now with knowing what the best thing is. The best thing is probably having enough exercise during the day that you're tired enough.
Sure.
You get enough sunshine exposure and light exposure during the day, and then that it's shut off close to bedtime, and you're using natural remedies to get to sleep rather than taking medication or hormones.
And that's those are some of the things I'm trying to work on for myself. As you know, you're my sleep doctor. I've had horrible sleep, and getting sunlight early on is not always easy for me because I'm inside the hospital. I'm in my office, so I have a full spectrum light that I try to get underneath at least 30 to 45 minutes every morning if I can't be outside. So that at least gets that access going in the right direction. And then there's some other things we're going to get to here in a little bit that I'll add, that whether I do them, whether they worked, or things like that. So how much sleep do we need then? And
So that's a very good question, and it has genetic implications as well as what you read as normal sleep hygiene. So a standard amount that you always hear recommended is between 7 and 9 hours a day, every 24-hour period. And that really hasn't changed over the course of hundreds and hundreds of years. Even before the introduction of light, it was only a little bit longer, maybe 8 to 9 hours instead of 7 to 8 or 8 to 7 to 9.
Right.
Only a little bit longer with the introduction of light. It changed a little bit, but also there's a question. For one thing, there's a genetic variable, and a small percentage of people can do just fine on 4 or 5 hours and live long lives, but they have a genetic short sleeper syndrome.
Okay.
And then there's also the question of those people who need more sleep. Is that okay? And for a significant percentage of people, if they need 9 hours, they're getting it consistently, and they're benefited by it and feeling a good wakeful feeling for the entire wakeful period of the day. That's fine for those people. So it isn't necessarily hard and fast. Everyone needs 7 to 9 hours. Number one. Number two, the quality of sleep you get is very important. So just getting a number of hours of sleep, if it isn't a good quality, makes a significant difference.
Okay.
I can show you graphically what it looks like. I believe somebody is now showing you a graph of what a normal sleep cycle looks like in a 7 to 9 hour period. And in this sleep cycle, you see 3 stages of non-REM sleep and REM sleep. REM sleep occurs about every 90 minutes, and the 3 stages of non-REM are in between the REMs. And the deepest sleep, restorative sleep, is stage 3. That's where delta waves in the brain are most prominent, and each stage of sleep has its own brainwave pattern. REM sleep is peculiar. It's called paradoxic sleep because REM sleep is the lightest level of sleep. It's also the most active in the brain. But it has certain qualities, certain features to it that make the body totally limp.
That's what I've heard. You're like paralyzed.
So you're paralyzed during REM sleep, but your brain is very active. That's paradoxic. And then there's some peculiar things that happen in REM sleep. For one, the body is, in men, causes erections to occur. Erections occur during REM sleep in normal men. Also, REM sleep is a time when the brain consolidates memories, as I was telling you, that if you have good REM sleep, that the next day you remember things better that you've learned. But REM sleep is associated with the weakest muscles on the outside of the body, so breathing is weakest during REM sleep. So when I first see people who have sleep apnea, a condition where they stop breathing, the first time I'm likely to see apnea is in REM sleep. So they'll have normal sleep, and then all of a sudden REM occurs every 90 minutes, and they start having weaker breathing, snoring is louder, and they have more interruptions of breathing. That may be the time when they wake up. So when I have people who come to me and say, I'm waking up every night at 2 a.m., what do you think the reason is? That's probably right around their second REM period. The first period of the cycle of sleep, they've needed sleep desperately because they didn't have it from the night before all through the day. They were tired. They fell asleep. They stayed asleep all through the first REM. But by the second REM, they had some sleep that was in their system. Now they're waking up because their breathing is weakest in REM, and they have trouble getting back to sleep. They're startled by not breathing well in their second REM. That's a classic interruption of sleep about 2 a.m.
Okay, that was going to be one of my questions for you. I hear people talk a lot about, I wake up at 2, 3 in the morning every morning.
And that may be the second REM for a lot of people.
That is interesting. So does the amount of sleep we need change throughout our life, or is it always 7 to 9? I know babies sleep a ton.
Very good question, yes. So you're right. Babies, up until the age of 6 months, it's like from 14 hours to 12 hours for infants till about 6 months. Starting at 6 months, the sleep cycles are very well established. Four stages of sleep, 1 REM and 3 non-REM sleep stages for 6 months all the way through to the end of life. However, there are a lot more wakenings as you get older. The wakenings may be associated with more light sleep in the course of a whole night,
Okay.
less deep sleep in the course of a whole night, but usually about the same amount of REM sleep in the course of a lifetime, all the way until we die. We have roughly the same amount of REM sleep, but light sleep gets more, deep sleep gets less, and wakenings, unfortunately, increase.
Frequent, right, okay. And we're not talking about, as men get older, having to get up to go pee. We're talking about stuff in our brain doing things different.
That's right. That's right.
Okay.
Now that's another issue. We can discuss it sometime, but nocturia, frequency of urination at night, is an issue that occurs more and more, and is a single reason that some people come to see me. I have about 7 different diagnostic categories of things that people come to see me for.
Right.
And a common one, a subcategory under sleep apnea, is urinary frequency.
Right.
And they'll be sent to me from a urologist.
Okay.
Or they'll just come because they're disturbed. The person is upset about getting up so
much. Right. Interesting. Very interesting. So the deep sleep's the most restorative for us then, is that right? Okay.
That's the one where your plaque buildup is decreased.
I gotcha.
And that's the most restorative.
And I don't know if you're familiar with a mushroom called lion's mane, and it has been shown to remove amyloid plaques in rat studies. I've been taking it for about 4 years now, so I'm hoping that maybe it's going to help me from accumulating all this amyloid plaque because I don't get enough sleep. But I'm one of those people that 4 or 5 hours of sleep and I'm fine. Until recently, I'm hitting a point in life where it's not cutting it anymore, and I'm feeling tired. But I never really had a problem with it until recently. So it's part of that. As we get older, our requirements change.
That's exactly right. It's very interesting. Something about in the 50s or late 40s is so common a time when people start to notice sleepiness a lot more. So the same person who may have moderate sleep apnea, where they stop breathing 20 times an hour, let's say, at the age of 30, they don't complain as much about sleepiness as certain other things, waking up with a headache or urinary frequency, or the wife or husband elbows them, you stop breathing again, you need to see a sleep specialist.
Right, sure.
But that person at the age of 50, now they're saying, I'm taking naps more, I'm falling asleep. I almost fall asleep driving. Every year the American Academy of Sleep Medicine and the National Sleep Foundation do a study and call 1,000 people at random. Phones, 1,000 people are called at random in the U.S.
Right.
Every year, about 20% of people will say somebody in that household fell asleep driving.
Holy smokes. That's nuts.
Imagine.
Right? 20%, that's a massive number.
They don't talk to their doctor about it. They're afraid to say something about it, but they admit that it's an issue. How about that? Huh?
Right? That's nuts. Hey everyone, Dr. David Scheer here with Unprocessed Sugar. Thanks for joining us for our first portion of our episode on sleep with Dr. Steven Scheer. We really dove deep into some of the causes of poor sleep and what people present to Dr. Scheer with what kind of complaints. Please stick around for the second episode where we're going to give you the fixes. We're going to tell you the things you can do to make your sleep better. Thank you so much for joining us on Unprocessed Sugar. Hi, I'm Dr. David Scheer, a doctor here in Florida, and thank you for joining us on our podcast. A quick note, this is for educational and general information purposes only. Listening to this podcast does not constitute a doctor-patient relationship, and please consult with your own healthcare provider before making any changes to your own care. If you are having a medical emergency, please call 911 or your local emergency number. Any items, tests, medications that we talk about or discuss are for information purposes only and are not an endorsement. Once again, thank you for joining us, and please see the website for the full disclosure and waiver. Thank you very much.